Varicose veins is an extremely common condition, affecting approximately 1 in 3 people. Women are most commonly affected, and there is a strong hereditary factor. Most patients with varicose veins don't have any significant symptoms, but in some, venous insufficiency can cause symptoms such as heaviness, aching, throbbing, itching, and leg cramps. In a small percentage of patients, more serious symptoms can occur, such as skin discoloration, varicose eczema, and ultimately leg ulceration. Conservative treatments for varicose veins include wearing support stockings or tights, but where more definitive treatment is required to relieve symptoms or to improve the cosmetic appearance, then a whole range of treatments are available, including surgical ligation and stripping, endovenous laser treatment, radiofrequency ablation, and ultrasound-guided foam sclerotherapy. Ultrasound-guided foam sclerotherapy, in my experience, is one of the simplest and effective treatments. In my experience of treating several thousand patients at the Nuffield Health Plymouth Hospital, I have found ultrasound-guided foam sclerotherapy to be as effective as other treatment modalities, yet it is one of the simplest to perform and also very cost-effective. The great advantage of this treatment is that it is literally a walk-in, walk-out treatment with minimal discomfort during and after the procedure. Before offering this treatment, it is very important that a consultation and careful assessment is made of each individual patient to examine the nature and extent of their varicose veins. There are 2 main superficial veins in the leg which can become varicose. The greater or long saphenous vein, which runs down the inside of a leg from the groin to the ankle, and the small or short saphenous vein, which runs from behind the knee down the back of the calf to the outside of the ankle. During the clinical assessment, a portable ultrasound probe in the form of a handheld Doppler will often be used to assess the competence of the valves within the greater and small saphenous veins. In addition, a more detailed assessment using a full duplex ultrasound scan should be performed before offering any treatment. In my experience, ultrasound-guided foam sclerotherapy has a very high success rate, with complete closure of the affected veins being achieved with a single treatment in over 90% of patients. The procedure involves the insertion of a catheter into the relevant veins using an ultrasound scanner to guide the placement of the catheter. Prior to inserting the catheter, a small amount of local anaesthetic is injected into the skin at the insertion site so that no pain is felt. Sometimes more than one catheter is inserted, depending on which veins are affected. In addition, small needle catheters, or so-called butterflies, may be inserted into some of the larger varicosities. To facilitate the insertion of the catheter and needles, this part of the procedure is performed with the legs tilted down, which causes distension of the relevant veins, making it easier to insert the catheter. Subsequently, the legs are tilted up, which collapses the veins. Injecting foam into small collapsed veins enhances its effect. The foam is prepared by forcibly mixing the liquid sclerosant drug with a gas. The majority of centres use air for this purpose. Our own research has shown carbon dioxide foam to be more effective than using foam made with air. Different concentrations and volumes of foam are injected depending on the size and position of the veins being treated. The veins are massaged to ensure even spread of the foam up and down the leg, and this process is monitored by ultrasound scanning performed during the procedure. It is important to note that the foam does not remain within the leg veins. It is rapidly dissipated within the general circulation and has no deleterious effects elsewhere in the body. Subsequently, the leg is placed into a full-length compression stocking, which is typically worn for 5 days following the procedure. We encourage our patients to exercise as much as possible, and normal daily activities are maintained.
I came to see the specialist initially regarding my vein because of the symptoms I was experiencing, They used to ache and be very uncomfortable if I'd been on my legs for any length of time, and to feel any pressure on them would be quite painful. The procedure itself was very straightforward and virtually pain-free. Almost immediately after I'd removed the stocking, which I wore for 5 days after, could see that the vein had shrunk in size quite dramatically, which was fantastic. There was a little knotting and a little sort of shading over the veins, which did fade quite rapidly over the next couple of weeks. The results after the procedure are fantastic. I've been so pleased. The symptoms that I came for initially, virtually disappeared, and the appearance is fantastic. I'd highly recommend it to anyone who is thinking about having the procedure.